Once again, thank you for staying with us. Our special coverage of this year's World Prematurity Day continues. And you can call in live. The numbers are there below your screen. You can call in live and send in your questions or your comments. And also on social media, keep them coming. I see Violet Miani saying, mine was premature and now is a grown-up. I thank God. Thank you, Violet, there. Keep them coming at KTN is KE, at Grace Korea KE. Dr. Lynn, I'd like to come back with you. And now I want us to talk about nutrition and feeding of the baby, because I'd like you to talk to us about how this is important in ensuring that this babies gain weight, and also the recommended setups for preemies to grow in the first few weeks, especially if, say, a mother got their child at home, especially now with the COVID-19 pandemic. In the first months, we saw a lot of mothers not going to hospitals or fearing to go to hospitals. Talk to us about that, the recommended setups for preemies.
Oh, good question. So, I'm sure we've heard this before. Nothing is as good as breast milk for the baby. For the baby, for the first 6 months, we recommend breast milk. And that goes for even the preemies. The preemies do need breast milk and must be breastfed as often as possible. It should be on demand. So long as the baby wants to breastfeed, the mother should be available to breastfeed. So the simple answer for preemies, as far as nutrition goes, is breast milk is the best. Now, occasionally, because these babies have been born a bit premature, they didn't have time to develop fully, there are some micronutrients that they might not have in sufficient quantities. So they might get supplemented with a prescription from the health facility. So anyone who has a small baby or a baby born too soon, then the recommendation is that they go to the health facility and they will get some nutritional supplements as well to sort of beef up the nutrients for this baby. So kangaroo mother care, like I said, is actually very good even for breastfeeding. The position will promote that bonding and will also promote the formation of breast milk. So again, yet another advantage for doing kangaroo mother care. So regarding these strange times that we're operating in since the COVID pandemic hit, there have been very many concerns, obviously, around taking care of the small babies, especially if the mother or one of the caretakers is COVID-19 positive. So as far as we know right now, there's no evidence that there's a transmission of COVID-19 to the baby through breast milk. So as the first rule is to breastfeed, because there is no that transfer of virus or transmission of the virus from the mother to the child through the breast milk. So the breast milk, if you look at like cost-benefit analysis, we have to look at the cost, the benefits of breast milk versus the risks. The benefits far outweigh not breastfeeding this child. If you give this breast milk to the child, you're not only nourishing them, but you're also giving them immunity. So we do recommend that these children, even during the COVID periods, get breastfed. But there are certain things that you can do to make sure to reduce the risk of transmission through, e.g. breathing, the respiratory transmission. So like I said, there's no transmission through the milk, but you can limit transmission, perhaps even through breathing. So one of the things that we recommend then is, one, the mother must be housed, roomed together with the baby. Do not separate the mother and the child. It's important that they stay together. But the mother can also practice some hand hygiene before handling the baby, so washing hands. And this is a good practice anyway, but it is more emphasized even during COVID. So wash hands and also breastfeed while wearing a mask, and that can reduce the transmission if there's a huge concern of transmitting this to the baby as you breastfeed. But in summary, breastfeed, breastfeed, breastfeed. Room them in the same, have the mother and the child in the same room, and practice hand and respiratory hygiene, the mask and hand washing when handling the baby.
Can we talk about the quantity of the breast milk? Because what I know, and correct me if I'm wrong, is a baby born, you know, with the normal weight, what we'd call the normal weight, maybe does not need a lot of milk during the first weeks. Correct me if I'm wrong once again, Dr. Lynn. But now, how about these preterm babies? They're so small, so tiny. What's the quantity of milk they need, and maybe even the mode of breastfeeding?
Okay. So, one, even the normal weight babies do require breast milk, and we keep saying breastfeed babies on demand. So long as the baby is asking to be breastfed, we should breastfeed them. I've had people who will say, no, train them to breastfeed every 3 hours or something like that. No, let us breastfeed the children when they do need. But now coming to the smaller babies, again, because they've been born a bit early, a bit too soon, some of their reflexes might not be fully developed. So then they might have a very poor suckling reflex. So in which case then the mother might use a cup and spoon to help with the feeding of this baby, but it's still breast milk, so they would express and give to the child. The quantities are dictated by the size of the baby, because, you know, we have like the extremely low birth weight, but the one good guidance is to do very frequent breastfeeding or expressed milk in this case. And as long as the baby wants, it must really be on demand, because if you're in the hospitals, they will do like a nice chart. They will show you per weight at the different times the baby, the amount of milk to give. But sometimes this is difficult to do at the home setting. But with the information at the facility, the nurses, the health workers will not discharge until they're confident that the baby is gaining weight and is breastfeeding well. And at that point, when you go home, you continue breastfeeding on demand. The baby will be able to request as much as they need.
Right, okay. So let's now go back to Mary. Mary, talk to us more about some of the challenges you experienced, say financially. Were there any financial constraints from your end?
Thank you, Grace. The most challenges you face, maybe while you are in the hospital, you hear your two babies, you are expected to change your babies every 3 hours. Or maybe in between. For me, it was a challenge. It was not a challenge, but I observed mothers suffer. The mother is here in the nursery. She can't afford even a diaper. That are some of the challenges mothers face in the facilities. For me, unless I lie, it was not a challenge. My husband was there for me.
Okay, so even financially, in terms of like the hospital stay of the babies, you did not experience any challenge, right?
I never experienced such challenges because remember, with the current government, even if you are not registered at the NHIF cover, you are covered by the Reader Mama.
Right. Okay, Mary. And that's where we take it from Dr. Lynn. NHIF, does it pay for the hospital stay of the preemies? I know Mary has told us about that, but let's hear it from you.
I told you I love Mary. She's a very informed patient client. So it is true that the current policy do allow for these services to be provided for free. So Linda Mama, NHIF, UHC, all these are really good government policies that will ensure that even preterm babies are covered and will get paid for. But my urge to all Kenyans is to actually register for services, even NHIF. You might find one aspect has been covered, and in the case of Mary, the costs were largely taken care of by Linda Mama and NHIF. But there are certain aspects that might not be automatically in the cover. I don't want to speculate, but it could be something like occupational therapy if the baby requires further support. So some of these additional services that are required, it is imperative that Kenyans live with the message that it is good to register themselves for NHIF. These options are available and they are quite affordable, so that whatever eventuality there is, even if the baby has to be sent for any specialized care, then that becomes available. One aspect of the care for preemies that we are still struggling with is, remember I mentioned the issue of micronutrients. So for babies who will require micronutrients, many of these families will go out back to their pockets to pay for this. But it is my desire, and I was hoping that Dr. Laura would be with us by now, so that she can speak to some of the initiatives that will be put forward to ensure that these other aspects are also well taken care of. But the hospital stay, the delivery, that will be covered under Linda Mama and NHIF.
Indeed, and it's unfortunate we don't have Dr. Laura Oyengo, but still, let me, still with you, Dr. Lynn, let's talk about what we can do as a community to support these interventions, you know, to save lives of our preemies, to ensure they thrive. What can we do as a community?
Mary and the husband have made my job very easy, because she's spoken to what it takes to ensure that preemies and their caretakers are taken care of. Mary's husband accepted and helped her accept the situation. It would have been very different if Mary had delivered twins and she was deserted or abandoned by the husband or blamed for the outcome. So the fact that the husband stood by her throughout is actually something to applaud. So my call then is to all husbands to provide as much support to their wives, to provide this support. And this is support that can be given not just by the husbands, but also the people around the woman. We know we have single women, we have husbands working far from their wives. So the support system needs to be in place for this woman to feel as empowered as possible to take care of the young one. And this support needs to start all the way, like I said, in the pregnancy period. So doing individual birth plans, for instance. You know, babies come, they will come with expenses. Mary has mentioned the issue of changing diapers every 3 hours or so. So there is a cost to it. So planning in advance, having a birth plan in advance, knowing which hospital you will go to. If you went to the hospital and you found that you needed to be referred because your risk factors are higher and you need to go to a specialized hospital, the people around you, the support system then would allow you to access those services and ensure that the day you go into labor, then you're also able to get there. Some of the other support is actually a very good example that Mary gave of the husband again, of him participating in kangaroo mother care. Traditionally, the name was called kangaroo mother care because it's largely the mothers who are doing, but we've expanded to actually just call it kangaroo care because we've realized that even the fathers, the other proxies can do this as well. And it is actually the role and the responsibility of the father to do it. So you will see in some places that we'll talk about even kangaroo father care, because in this case it's the fathers we are calling upon to be the ones to do. There's nothing, the warmth is the same, the chest is the same, so do allow, share the role of parenting in this case, to allow the woman also to take a break, so the two of them together will be able to put the baby in care for close to 24 hours every day until the baby has gained sufficient weight to be discharged from kangaroo mother care. And I can say, by the way, kangaroo care is done both at the facility and at home. One strong advantage is actually because it allows for early discharge of the babies. Hospitals are not the best environment for babies because, you know, there's a psychological pressure of being in hospital. There are costs. Maybe the parents would be taking care of other children at home. We want to be at home. Plus also like the risk of some what we call nosocomial infections in the hospital. So if a baby was to gain weight slowly in an incubator, they would not. It's not usually practical to send them home with an incubator, but you can send them home on kangaroo mother care. So in terms of the support systems, once they are doing kangaroo mother care, whether in the hospital or at home, let the environment around this child be as supportive as possible. The other thing I would call for society to do is to try and reduce the myths and misconceptions around preterm babies. It's so unfortunate, you know, like Mary was mentioning, people would come to see her and ask her, "Kwani umezaa panya? Have you given birth to rats?" And that is true in many instances. And in fact, for many of our communities, if they give birth to a preterm, they will not even name that baby until they see that the baby's chances of survival have increased. So it's almost as if we are devaluing the life of the preterm, yet it is actually a full life, and they will grow to be like normal, completely normal adults. The preterm is just as much a baby as a full-term baby. Mm-hmm. So the issues of kuzaa panya or our social norms that sometimes prevent us from embracing these children, mm-hmm. We should try as much as possible to move away from that. And that's one of the benefits of this day when we're raising awareness about prematurity. So as a society, let's not look down upon these small babies.
Right. Or we can even make it kangaroo parental care, Dr. Lynn. Okay, let's talk about the achievements or the milestones made so far as a country. I'd like you to take us through that, but I also want us to go back to 2019. The theme of the World Prematurity Day 2019 was Born Too Soon, providing right care at the right time, in the right place. Did we achieve that?
Mm-hmm. So, the first question, the milestones. Kangaroo mother care officially came into the country around, I think, 2016 thereabouts. Ourselves, Save the Children and other partners was working hand in hand with the Ministry of Health to look at global evidence around kangaroo mother care and the value it would have for our children. And we ourselves, as Save the Children, actually began our pilot in Bungoma County. That's where we introduced kangaroo mother care as a way to demonstrate how it works and what is needed to be in place for the public health system and actually even the private health system to adopt kangaroo mother care. So hand in hand, we worked with government, set it up first in a few facilities, trained all the health workers there, mobilized communities, did a lot of community engagement to teach the communities about kangaroo mother care, gathered even insights about the practices, how do we take care of these babies, to even further inform the program, to be sure by the time we are scaling it up across the country, we have learnt as much as possible and tweaked the program to remove any challenge, to mitigate and reduce any challenges that are present, so that by the time we are taking it across the country, we know how it will work and what needs to be in place. We worked hand in hand with the ministry to even develop the guidelines for Kenya, worked hand in hand to develop the reporting, the indicators we used to report to track how this work is being done. Worked with the county governments. It's actually been truly amazing working with county governments to get them to allocate resources to establish kangaroo mother care in the different facilities. And in fact, as I speak about this is one other thing that we're talking about. Communities must rise up and demand for these services from their leaders. So making sure that these services are available across the country. We've seen the value of kangaroo mother care. It starts in the facility, continues at home, but the facility must be equipped to be able to do that. The health workers there must know. They must know how to do it. They must have the reporting tools. They must have the beds that's somewhat inclined to allow for some comfort in that space. The room itself is usually much warmer than rooms outside. Like I mentioned, babies have these small babies have a difficult time regulating their temperature. So there are a few things that must be in place in all these different facilities. So it's important that this happens across the country. So back to the progress. We introduced kangaroo mother care, started in a few counties, and I'm so happy right now to say that we have kangaroo mother care in more than 35 counties. My desire is that every county has kangaroo mother care, and not just the main hospital, not the county referral hospital, but let's see kangaroo mother care in the smallest facilities. So long as the facility is able to provide delivery services, they should be able to do kangaroo mother care and support mothers. Like you said, there are very many mothers who have challenges accessing healthcare. So you can imagine if you deliver a small baby and then your nearest facility does not have these services, you will have to go too far, and by that time, the consequences might be dire for this baby. So in terms of progress, a lot has been made. And by the way, Save the Children, the ministry, we're also working with a network of, we call them kangaroo mother care champions. These are health workers who are so motivated and are ready to push the agenda of kangaroo mother care, to push their county budgets, their county governments to allocate monies towards kangaroo mother care across the country. So we have 35 out of 42 counties currently offering these services.
Okay, Dr. Lynn. So now, unfortunately, time is really not on our side. I need to get your closing remarks. I'll start with you, Dr. Lynn. Let's get your closing remarks, your clarion call to say community members, mothers or parents, would put it like that, to preterm babies, even in your capacity as head of health and nutrition, Save the Children, and perhaps how one can reach out to you if anybody needs your help.
Okay. So I think I'll draw my closing remarks from Mary's case. We want mothers who are as informed as possible. We want mothers who seek care the same way that Mary did. We want health facilities that provide the right services the same way that Mama Lucy provided these services for Mary. We want a society that supports the mothers of premature babies and the premature babies the same way the husband of Mary did. And lastly, we want as a community to come together to push this agenda so that we change our values and systems around how we see premature babies. And we also demand for the right services from our governments. In terms of reaching out to Save the Children is on the net. If you just Google Save the Children Kenya, you will see us on Twitter, you'll see us on Facebook, and the contact page will even have information around emails and phone numbers. If you want to reach out to me, my email address is lynn.kanyuru@savethechildren.org. Thank you.
Right, thank you so much, Dr. Lynn there. Mary, you have the last say. Let's get your closing remarks. In under a minute, please.
Okay, all I want to say it is to thank God for being there for me and my family. I would like to thank my husband for being supportive. And finally, I would like to thank the Mama Lucy Fraternity, the NBU department, all the sisters from the NBU department. Mungu abariki sana. You really taught me a lot. Mlinifundisha jinsi ya kulea watoto. Naombea maisha marefu, mukazidi kusaidia wamama wengine. God bless.
Amen. Asante sana, Mary. We do appreciate, and even your husband, Bethwel Mathenge there, we do appreciate the both of you. Thank you so much, Dr. Lynn Kanyuru, the head of health and nutrition, Save the Children, and of course, Mary Kinothia there, who is a parent to twins. Thank you for tuning in. Thank you for all the feedback that you did send in across our social media platforms. This has been a KTN News special on World Prematurity Day. My name is Grace Korea. Do enjoy the rest of your viewing.